Sean, let's get your reaction, though, first on this new variant of the coronavirus. You're looking to test your vaccine with that. How long is that going to take?
Well, just as we did at the beginning of the year, we can develop constructs against variants within 6 weeks. The question will be for us, once we do that, what regulatory discussions we should have, if necessary, in order to get such a vaccine against a variant approved. And of course, that's something that we need to do later on. But 6 weeks, we can have a new vaccine ready for discussions with the regulators.
At the moment, the indications that we've gotten is that there's no evidence that a vaccine of the current lines would not work against this new strain of the coronavirus that appears to be emerging out of the UK and some of the other countries. But there's neither any evidence to say that it's going to be as effective, right?
Yeah, I mean, that's something we've got to test. But as variants have emerged, and this virus, like all viruses, is unstable. That's by nature. Viruses generally are. You see new variants. We've tested 19 variants to the original variant we encoded in our vaccine, and our vaccine continues to be effective against those 19 variants. This is a new one. It's new in the last few days. So we're currently testing in the laboratory to see if this variant or our vaccine works against this variant like it has done with the other 19 variants.
BioNTech is looking to expand production. We understand that you're in discussions with the German government. To what extent are they likely to get involved and help you sort of set up some of the facilities?
Yeah, the help we're seeking from locally is really about approval of our existing facility in Marburg to get it approved for production by the regulators here locally in Germany, and of course then at the European level, at the EMA level, the European Medicines Agency, as early as possible, because it's really important for us to manufacture as many doses as we can, as early as we can, and that will be the aim of working with both the government and the EMA in order to help to assure that.
You're looking at what, 1.3 billion doses in 2021, maybe more than that. If you can get up and running with your kinds of investment plans around facilities and production, what is possible? What kind of number is achievable beyond that?
Yeah, I mean, this depends on a lot of factors, and you can go up significantly more from 1.3 billion. The base plan is 1.3 billion. We think that's achievable and realistic. That, of course, is in combination with our colleagues at Pfizer. Between us, we share a network of factories. And Marburg, the factory we bought from Novartis, which we were just talking about, would become part of that network.
Do you expect to have any stumbling blocks with the border closures in the UK and some of the wider disruption that we're seeing at the moment in terms of virus vaccines getting into the UK?
No, we don't anticipate shipping challenges. We ship by plane, boat, and lorry. If the Channel Tunnel to the UK is shut, there are other routes into the United Kingdom.
And what about operating conditions, or let's say transport conditions, right? So it needs to be stored at negative 70 degrees Celsius. Is that making it a little bit tricky because you have to develop the rollout infrastructure, the rollout logistics to be able to leverage?
No, don't forget that together with Pfizer, we've designed the shipping boxes to act as -70 freezers. So we simply put the vaccine doses and the vials, which are contained in the vials, into these shipper boxes, which have dry ice in them to keep them at -70. We pack them and we ship them. So no, we don't see any issues there at all.
What are some of the other factors, Sean, that would have an influence on your decision to either keep capacity targets where they are or increase them?
Well, I think that there's 7 billion people worldwide that we would want to vaccinate with our vaccine. So any ability to increase the capacity would help to achieve that aim. We've always said that this is a global pandemic, and for those who want access to our vaccine, we will give them access through purchase agreements, and that still remains the aim. So I think that we're very focused on that, and if we can increase capacity to do that quicker, then that's what we will do.
Sean, just a closing question on these different variants of the coronavirus. So is it correct to say that your design of the vaccine has an ability to be calibrated to different
variants,
strains, different variants of this coronavirus?
That's exactly right. And that's one of the enormous attractions of using mRNA. The ability to make a new vaccine extraordinarily quickly is one of the significant advantages. This is one of the things we started with Pfizer with flu 18 months ago. And of course, now we can apply that to COVID virus too. And it's the speed with which you can change your vaccine that makes mRNA particularly useful in a pandemic situation where you are seeing changes to the virus. As I say, the virus so far, the variants we've seen so far, have not affected the efficacy of the vaccine.